As a parent, you want to make sure your kids are healthy. In this week's Ask the Pediatrician segment, Dr. Celina Moore is talking about the importance of vaccinations. Doctor, good morning. Thank you for joining us.
Good morning.
Very important. Kids are back in school, so they've already got their shots. But for new moms, what can they expect as their children get older to give them their shots?
Well, we like to start protecting babies before they're born. So obstetricians recommend a tetanus with diphtheria and whooping cough vaccine during pregnancy. So we encourage all moms to get that vaccine to help protect the baby in the first 2 months from whooping cough, which can be deadly.
A lot of people are against getting shots, but they are necessary.
Yes, they are, and there's a lot of misinformation.
Right.
There's a lot of misinformation out on the internet. Your best bet to clarify any concerns or doubts or fears that you might have is to talk to your pediatrician.
All right, there's been a recent measles outbreak out there, so how does that happen?
Well, measles is highly contagious. It's very contagious. It aerosolizes in the air, so you can sneeze and it hangs in the air for hours afterwards. Wow. And so because it's so contagious and you don't need much of the virus to become sick, we depend on what's called herd immunity to protect everybody. There are people who cannot get the measles vaccine. Children with undergoing chemotherapy or infants or pregnant women can't be getting the vaccine. So we depend on other healthy people to be immunized to protect those that can't be protected.
All right, if your child is scared of shots, and that happens a lot, are there ways that we can help calm them down?
Right, it can be as simple as not showing your own anxiety in front of the child, because the child will feed off of that. So being nonchalant about it, saying it's just going to hurt for a minute and then, you know, we'll just go on with our day. Not promising big toys afterwards, because the bigger the reward for getting a vaccine, the more pain is perceived by the child. And we have other things, you know, distraction, for example, application of ice, or even there's this little, what we call a buzzy bee, which is a little vibration that you can put on the arm.
Oh, that's a good idea.
And it decreases the pain, actually.
Yeah, so it kind of stimulates you in there and gets your mind off it. You're doing something else. Maybe don't tell the kid, I hate shots too.
Right,
that kind of gets them a little edgy. Yeah, don't do that. All right, can your child have a bad reaction? And if that's so, what can you do?
Serious reactions are very rare with vaccines. They can still happen, but they're very rare. The most common reactions that vaccines will give you are fever. And there are only a couple of the vaccines that can do that, such as the tetanus, the DTaP that I mentioned earlier. The measles vaccine can give you a fever, and chickenpox can give you a fever as well. That's usually the extent of it. Some of them can cause localized swelling and redness of the skin.
If you can't afford vaccinations, what should you do?
The Department of Health offers free vaccinations, and most pediatricians participate in Vaccine for Children, which is funded by the government, and they can get free vaccines at your pediatricians.
Good to know. A lot of good information as always. All right, thank you, doctor.